Hello, folks,
Hi.
and welcome to the HSL webcast. This is season 3, episode 2, simplifying SimBaby and services. We got some new services. Hashtag building for better outcomes. You got your co-host Shane Peddle and my wonderful co-host Alyssa Lapierre. Hey, Alyssa.
Hi, how are you?
I'm excellent. Actually, let me just bring up my camera here so you can
Yeah,
actually see my smiling face.
perfect.
Hi, there we
Hi.
are.
I'm so excited for today's episode. Thank you all for joining us. We've got a lot in store for you, so I think we can get right into it. How does that sound?
Absolutely. Absolutely. Thank you again so much for joining. If this is your first time here, thanks so much for showing up. This show is for you. This show is to get to the end users so that we can get you better using those products, getting those better outcomes and best practices for patients, and lowering morbidity and mortality rates. And you know what? Helping save more lives is our goal and our mission. And that's the way that this webcast is named, HSL, Helping Save Lives. So awesome. So what are we doing today?
Yeah, we've got a lot in store. So we're starting off with some of the new Laerdal services. If you haven't heard about them, this is a great place to be because we're going to be talking about the Accelerate program as well as the Freedom Flex services. So that's going to be super interesting. We also have some of our experts on services in the chat. So should there be any questions, feel free to
Mm-hmm.
ask them. We're going to try our best to answer as well as we can, but sometimes we do get a lot of questions that we don't end up getting to just in the nick of time, but feel free to put them in the chat. And then we're moving into our fellow SimBaby. So Shane, what can we expect there?
Awesome. So I have my SimBaby, my demo unit. Leo is with me here
Leo.
today. And Leo actually went on a little trip not too long ago. He went down over to Toronto and he had a trach inserted. So my original SimBaby didn't have a trach, but now he has a trach. So we'll talk about how, if you already have a SimBaby, you can still get a trach put into him. It just requires a return to bench for a little bit of service. But and we'll talk about some of the differences that come with that. But yeah, we're gonna show you SimBaby. We're gonna show you some of those special features that people asked about, as well as we're gonna dive inside of SimBaby's airway and see how that laryngospasm works.
Awesome. That sounds really cool. I'm excited. And
Yeah, me
then we
too.
get into our hot topics. So, for those of you that haven't yet heard, we are returning with a simulation user network conference in September. So, we're going to give you a little bit more details on that, how you can save your seat and learn more. And then we have our typical in the know segment where we're going to just update you on any of the software versions that you might have for Leap or SimPad. So, feel free to ask any questions there, but not too many changes. And then we get into the really fun part, which is the giveaway. and
Free.
we're going to talk about some of the suggestions that you guys provided us in terms of what you're interested in
Thank you.
seeing. And we appreciate that so much because, again, as Shane said, this is for you, built for you. So really, we want to make sure we're kind of getting your
And
outcomes out of this.
And Alyssa, we got a really nice email from Australia.
Yes.
Australia people, we love you to pieces. We are going to start working on making a show for you. So if you're listening in from Australia, probably not right now.
Maybe
But
not.
if you're watching the
Recording.
recording, send us some of the things that you specifically would like to see, and we'll make sure that we do it in a time zone so that you can be conscious for the live version. So
Yes.
hang on tight. We're working with you. We got your email, and we'll see exactly what we can do. Now, that being said, if you ever need us there live, just let us know.
Yeah, if you ever want to fly us over to Australia, we'd be happy to come.
Yeah.
Awesome. So let's get into it, Shane. First off, with Laerdal Services, you're going to tell
Mhm.
us a bit about the Accelerate program. What do we need to know here?
Yeah, this is a brand new program, and we're really looking forward to seeing how this will work in the clinical environment or in the educational institutions. So this is an all-in-one solution. So let's say you don't have buy-in yet. Maybe you don't have that big, huge budget to actually go out and buy a simulator, or even just a moderate budget to go out and buy a simulator. This is your all-in-one solution that brings simulators, operators, facilitators, the curriculum, debriefing, and as well, it's a sustainable, robust, and data-driven solution from our sim capture, where we can come in. We deliver the simulation, the service, the debriefing, all the help that you need, and then we pack up and we go away. So we come with everything and we leave. So there's no maintenance, there's no updating of equipment, there's no washing mannequins after.
Storage.
This is
This is
nothing
great.
like that. So this is the ability to kind of have a one and done, have a two and done. Let's say, and especially when we go to the next slide here, when we're talking about the three different offerings that we're offering currently right now, especially where we're in infancy with this program, what can it offer? And so we're mainly focused on those obstetric emergencies, you know, your PPH, your shoulder dystocia. We're going to be looking at neonatal resuscitation when it comes to obstetric emergencies, the advanced airway management, and nurse onboarding. So that's the main three focuses. So again, just like what Alyssa was saying, we have fantastic people that know a lot about this Accelerate program in the chat. So if you have any questions about, you know, what we can do and what we can provide, this is a time to ask them. They're there waiting for your questions.
Awesome.
And then if we go to the next slide, these are the additional benefits. So there's no big capital investment that's required. These worry-free, predictable operational expenses with flexible billing options. All of our curricula is built by our subject matter expertise. And so when we dive into the curricula that you need, we can show you the references for all this. And we also use the latest equipment. So, you know, SimMan 3G Plus, I would imagine would be a great part of this team, where maybe you only need 3G Plus for a couple days a year. This might be a great way to get a fantastic simulator for a very low cost, or a no big capital investment cost.
Right.
So that's the Accelerate program, and I'm excited to see conversations around this, because it would be someone like myself as a field service engineer, as an educator, that would actually be bringing these simulators to your site and actually hanging out with you for the day. So
that sounds like a dream.
Yeah, well, I mean, we get to hang out.
I just wanted to mention, I don't know, I saw someone raise their hand. I don't know if there was a question, if Shane, you see the chat, but I just wanted to quickly clarify, because I know we have a really nice international audience. These services are right now available in Canada and the US. If you're by any chance in another country and this really interests you, I definitely suggest reaching out to your client executive or your Laerdal person, and kind of telling them about this idea and seeing how maybe we can implement this in other countries. So I just wanted to put that caveat up there before I forget. But yes, I don't know, Shane, if you see any questions we can address. If not, keep those questions going with our team in the chat. So thank you.
I see one question. I will be purchasing SimBaby this July. Will this model have the trash?
The tray?
Oh, the tray. Okay, maybe that's what it is. I was like, trash. I was like, I don't know,
not.
But that's okay. That's a fabulous question. So the baby does come in two different versions. So it can come in just a regular spelled. Totally get it. I get it 100%. So you can either have the SimBaby. When you get a trach, all we're doing is taking the pharyngeal edema bladder that's in the posterior aspect there, and we're just relocating that and making a small incision. And we're going to see that when we go look at this SimBaby. So you can see, and then you can actually say, okay, well, do I want the trach or do I not want the trach? And we can talk about why some people go with the trach versus some people don't.
Yeah, great answer.
Great question.
Yeah, no, keep them coming. And if whether they're on services or not, we'll get to them. So no matter the topic, we'll as long as it's simulation, obviously. Yeah. Moving into Freedom Flex, which is our second service that we're going to be talking about today. So this one is a great solution if maybe you identify as an organization that perhaps needs to purchase multiple simulators, but prefers to avoid a large capital upfront expenditure. Or perhaps you desire to run a simulation program free of the logistical aspects, so things like maintenance, upkeep, repair, updates, and things like that. Or you really also just believe in the latest and greatest simulation equipment for your simulation program. So to kind of boil this down, this is somewhat of, I would compare it to a subscription in the sense that you're subscribing to this program and these products. However, it's more of a contract where you're not owning the equipment, but sort of like renting it, if we could make that comparison. So the Freedom Flex program is a 3-year subscription that eliminates the burden of upkeeping the equipment, but also maintaining that leading simulation program that all of us really want to achieve. So some of the features that we can get from this type of program include the worry-free equipment, your budget maximization, flexibility to upgrade the equipment, which we'll see in a bit, and the ease of renewal, as well as subscription optimization. So let's see how this kind of all comes together. So if you were interested per se in this sort of Freedom Flex, how does it work? Where do I start? So essentially you would be picking your eligible equipment, which could include some of the products that we listed below. So let's say you wanted a SimN 3G Plus, a nursing ed simulator, a SimMom for obstetric scenarios, and a SimNewbie and a baby, and maybe some partner products like the lung solution, as well as the scenario cloud. So you can kind of bundle basically what makes sense for you and your curriculum to get the outcomes that you need. And then once that is finalized, we begin the subscription when the equipment is actually installed. And the installs are included for the products that you decide to take into this subscription. Laerdal now actually maintains this equipment, so you kind of don't have to worry about this. We're making sure that you have your products working at optimal performance. There's reduced downtime. You get your preventative maintenances in. If there's a requirement and to change the product because of an issue, we also offer those replacements as well. And also a really, really interesting point is within the first 35 months of this, if a new version of a simulator is released, so let's say you have the SimN 3G and the 3G Plus wasn't yet released, but within that 35 months, it comes out with the Plus version, and you were very interested in making that switch, you have that option within the term that was outlined. And so at the end of the 3 years, the last step is that you can either renew the subscription with the existing equipment you have selected, or perhaps kind of do a new mix and match of different solutions that you might want to try moving forward. So that's a little bit about Freedom Flex. And again, just to kind of sum up,
Alyssa, I got one
about.
question there, because
Yeah.
I know some of my clients. So let's say I have a SimBaby.
Yes.
And I want to use it with Leap laptop. Is that possible, or do I have to use a SimPad Plus? Can I use a SimPad Plus and not the Leap laptop?
Yeah, totally.
Okay.
We're going to talk about that in the demo. Actually, that's a great question, but you can actually operate with both. So within the Freedom Flex specifically, but in general as well, you would get you obviously want your operating device that is controlling your simulator to be part of the solution you get. Otherwise, it's just kind of a body. But in the Freedom Flex, you actually get your simulator and your peripheral equipment. So whether that be your Leap laptop, your SimPad, your patient monitor. So that's all within this program.
Yeah, because I know I work with a lot of clients, and sometimes they have one group of facilitators that they might use SimBaby, but they want to use SimPad with it. Right. And then I have some other facilitators that are using nursing and simulator and like, I don't really like SimPad. I like a laptop.
We prefer laptop.
So
I think it's definitely kind of you get to pick and choose what makes sense for the simulators and get like the best solution for your fully optimized simulation program. So I don't see that as being an issue. But yeah, great question. We love those types of questions too. And just to conclude, again, installs included, upgraded equipment, you get your annual preventative maintenances that are really optimal in keeping your equipment up to date and operating as best as it really can. Some of you might be familiar with the loaner program. In this instance, we wouldn't really be doing that whole, you give us back the simulator based on your serial number and we give you a loaner in the time that we fix it. And then there's a few exchanges that take place. This is really just, we'll replace the unit, take it in and take it out, and then you're ready to kind of get back and up and running as quickly as possible, the lowest downtime. And then a really nice add-on to this is that you actually get access to these biannual impact meetings where we have someone that would be assigned to your case and actually following up and seeing if the items that you chose or the simulators that you chose are fitting your needs. If yes, if no, why, and get a little bit deeper into how we can make the solution a better fit for you or optimize that fit. And then lastly, again, the really cool part, I think, is the opportunity to upgrade if we do have new product launches, which could definitely be a really nice way to kind of leverage new technology and simulation. So that's a little bit about Freedom Flex. I don't know if there's any questions before we move on, but
yeah, I haven't
know.
seen, can one use both? And I think that's what we're talking, going back to the Leap laptop versus the SimPad. That would be the Freedom Flex team that can definitely reach in and find out, you know, can we use both? Can we have two different sets of peripherals? And if someone on the Freedom Flex team want to grab that question, we will find out more information and make sure that we get back to you and make sure we got a good answer for that.
Awesome. Well,
there's another question there. What if you're only interested in one or maybe two different mannequins? And I think that's what this Freedom Flex plan is all about. You can get the whole family. You can get one, you can get two, you can get, you know, if you need two SimMan 3G pluses, or you need a SimMan 3G plus and a SimMom, and then you find out you're not using the SimMom much, and then you go to these optimization meetings, and, you know, maybe a nursing and simulator is a better fit there. You know, so these things are all, that's why I think that name of the Freedom Flex is kind of really generates that kind of idea that we can create it and then see how it looks for your system. It is in a 3-year, okay, I understand. Right now it's only being available, and correct me if I'm wrong, Alyssa, in a 3-year subscription plan?
Yes. Yeah, so I think we had mentioned,
and the annual cost is another great question, and I understand that that's huge, but that would be a conversation because of where we're dealing with an international and even Canada and the US, those prices are going to differ. So it's reaching out to your client exec to get you more information about that Freedom Flex, including a pricing plan, because you can imagine one person that only needs one SimMan 3G plus versus another person that needs 5 SimBabies. You can see how that plan can be different.
Yes.
Yeah.
But well said. That's kind of the gist of it. It depends on what you're selecting, and also kind of obviously the term is the same and when you start out, but ideally the whole point behind this is to help kind of reduce those big capital expenditures that happen in that one lump sum, and in the end the return on investment and the capital investment for the customer, there is a benefit obviously, but again we can't really give a price because everyone would have such a different solution. But there is benefits to this program. So should you be interested, we highly suggest reaching out to your representative if you're in Canada and the US. And if you're elsewhere and this really interests you, again, I still suggest reaching out.
Start the conversation.
Start the conversation. Yeah.
Absolutely. That's only one way to get the ball rolling.
Exactly. Awesome.
Yeah,
well, Shane, with that, I'm so excited for this part. SimBaby is one of my personal favorites. So we're going to get into it, and we're going to talk about some of the features and functionalities, any tips that Shane can give us. So I'm actually going to stop sharing. And the way we're going through this is we actually got a few requests from some of you on what you wanted to see feature wise. So we're going to kind of go through that list. But if you have any questions, throw them in the chat and I'll ask them to Shane as he's presenting. So let me just highlight you, Shane, or spotlight.
Hello, everybody.
Yeah, there we go.
All right, so let's, we're going to change my, we're going to go over to, there we go. There's our top down view. Awesome. And here we have just the side on view. So I have SimBaby right here. So this is SimBaby with a trach. So this SimBaby, I originally got Leo without a trach. And when the trach version came open, I sent him back in, and they were able to take the pharyngeal bladder, the pharyngeal edema bladder, and reroute it out to the trach here. So now we can actually have a trach that can be open, partially closed, or completely closed. And so we can start working on those skills. So first on the list, Alyssa, I hear from people all the time that SimBaby seems a little bit big.
Yeah.
Did you ever hear that before?
Maybe once or twice.
Yeah. So SimBaby, let me just, I can hold SimBaby. So SimBaby is completely tetherless, doesn't require any kind of plug-in. The battery will last up to about 4 to 6 hours, depending on what you're doing with him. If he's seizing, obviously, for 2 hours, his battery will probably drain a little bit faster, as you can imagine. But he's not really good for me to show because I have a long torso, so it probably makes him look a little bit smaller than what he is. But if we put him on the Braslow scale, I got a Braslow tape right here. So if I put his head right at the top, his heels actually land right in the middle of the red zone, which is indicating here at 8 kilos or 9 kilos. Now, I'm really sorry about my conversion. It's very bad from kilos to pounds, but in the 8 to 9 kilo, when I looked it up under the World Health Organization for weights, they say that that falls perfectly in around a 9-month-old baby. So really good for those PALS courses in regards to the size.
Mhm.
And you can see here, he's just happy. He's just moving around.
Yeah,
Yeah.
it's
So he
funny.
has
I'm just
no
reading.
external compressors. Everything
Nope.
is a closed unit.
Yeah.
His skins are now made out of silicone. So no more of that PVC skin. And then the silicone, you can take a pen, you can take a permanent marker, you can write on them, and it all washes away. So none of that full permanent scarring from a pen mark, where I know a lot of our simulation specialists have put up signs saying that this patient is allergic to pens. And I always thought that that was such a cute and creative idea to make sure that we were away from our pens, getting the pens away from the simulators.
Right. Just some
Excellent.
funny comments in the chat. Alita says, we refer to it as a sim toddler here.
Yeah.
And
So, and that's a
some
really,
people call him Todd, short for toddler.
oh yeah, yeah. So I completely agree. And I've also seen them, I've seen a couple simulationists in the forums on Facebook, and they posted up pictures where they actually dressed the baby up, and the baby's definitely looking like a walking toddler, so definitely
Right.
over the age of 1. So I
Yeah.
hear you, but again, I'm trusting my old Braslow, and the American Pediatrics Association actually with Laerdal created this SimBaby for this size.
Mhm. Awesome.
Yeah.
And so Shane, if you don't mind, we can get
Mm-hmm.
into some of the requested features. The first one
Yes.
people wanted to see is, how do we assess the capillary refill time? And I guess, how
Oh,
do we start
that's
that?
a good one. I love showing this one. So this is a new feature that came with the new tetherless baby. So let me just go back over here, and I'm going to dim my lights down a little tiny bit so that you can see it. But right in this sternal plate right here, it's going to show for central PMS, and just underneath my finger is going to be a glowing light. And when I let it go, you can see that that light turns on and then disappears with after 2 seconds. Are you able to see that, Alyssa, on the
Yeah,
screen?
it's a little bit faint, but again, I feel like that's just yeah, there we
Yeah,
go.
there we
That's
go.
good.
And then, so that's their central cyanosis, or central PMS, or cap refill, sorry. I'll get the name right. And then over here on the left hand, we have the same response here. And now that response inside your leap can be changed from 2 seconds. We can move that right on up until I'm up to 6 seconds. And you can also have a differential between the central cap refill versus the peripheral, so that you can really show triggers of the peripheral collapse versus central collapse, and really start to talk about those triggers and how they can start an algorithm of treatment that you're looking for best practices, for sure.
Awesome. And the second one, if you don't mind, oh, actually, hold on, there's a question. Someone is asking, oh, and we didn't have this in our feature set. So can you see central and peripheral cyanosis? I guess since you kind of mentioned it.
Yeah, so the central versus peripheral cyanosis, I mean, that's a great question. Right now, he will show cyanosis in the, let me just get him, I'm gonna make him a little bit not as nice. Let's go here. Trends. Okay. We can get right into that one in the next. Okay, here we go.
Yeah, so
Silly rabbit.
he'll have features of cyanosis in the face mouth area. So he does have these two little lights that I don't know if we'll be able to, I hope we'll be able to see it. It might be a bit bright.
I'm working on that right
but
now.
if not, we can send you a picture, Donna. It's actually a really cool feature. It's just, oh, there you go. You kind of see it. Yeah, if you create a shadow on the baby, there you go. So those
you can see that cyanosis. I have a lot of lighting here because we're doing this podcast, webcast. But if I turn on a lot of lights, but you can see that cyanosis. And when I'm directly looking inside the mouth, I definitely see a lot of cyanosis inside the mouth as well.
Mm-hmm. And I believe so. The mouth is the only area on the SimBaby that is displayed, correct, Shane? There's no other. Yeah. So
but I mean, again, with your cap refill, with the central and the peripheral cap refill, that's a really good way to determine peripheral versus central, either cyanosis or circulation, really, as such.
Awesome.
Yeah, good question.
Okay, and thank you for the question, Donna. And someone is asking about eyes, so I figured that's a perfect segue into our next feature that people wanted to see, which is the pupillary reflexes. So the question is, are the eyes currently half shut?
No, it's the angle of the camera. So if I can, I moved him down too far. It's the angle of the camera, and if I were to sit the baby up, his eyes are completely open, but where the camera is kind of looking at the top eyelids right here, you're seeing kind of maybe a half closed, but his eyes are wide open. And I can actually I can change his eyes. So this would be half open here, and on your screen it looks closed, but it's definitely half open where there's a altered level of consciousness there. And then we can completely close them. Oh, there's wide open. Here's closed. And then we can actually, show signs of, an ICP, intracranial pressure, or stroke or anything like that, where we can have one eye open and one eye closed. And we'll open them up all over again. Actually, while we're here looking at the eyes, we can actually look at pupil reflex as well. All right. Yeah. Actually, do you have another one for me for this view?
Currently, are there, blinking frequency options?
Absolutely. So actually, if I flip over, you guys are asking fantastic questions, and sometimes they're better to be shown. Can you see my screen here now?
Yeah, we're seeing leap.
Yeah, so this is my control right here. So here's my eyes closed, half open, and that's how I was able to change that. But your blinking frequency is right here. So we can have a seizure just in the eyes alone. One left, one right, one both. So you can see you have a lot of different blinking
features.
Differences, but also as well as the sensitivity. So just like SimMan 3G, this baby has reactive pupils to light, and they're consensual as well. So they have perla. So that's another big thing that comes with this new SimBaby. And you can see here how I can change the pupils from fully dilated to constricted. To break the link here, I can have one dilated, one constricted. And so you can see how I can make those changes right here, and then make changes to the light sensitivity. So do they react? If it's slow, the right direct only, left is none, or vice versa, the right is none and left is direct only. So you can take away the consensual relationship between the oculus dexter and the oculus sinister. I always miss those words, but you can actually change the connection so that they aren't consensual and they don't accommodate to light the way that they should. Great questions.
Yeah. So with that, I don't know, okay, you have those features right now, constricted and dilated, and will they be reacting to the light? I think we can see if
so works. I'm gonna see if we can see on the camera. Again, this is going to be a little bit tricky because we're all kind of dialing in on the camera, but if you look into the pupils here, I should be able to get them to constrict, and you can see that they both constricted and there was consensual, and that's coming from the right eye versus if I go over to the left eye, there it is again, where they are reacting with consensual effect here. So that is our pupil response. Were we able to get that on the camera?
Yeah,
okay,
that was
Alyssa?
that was really good, especially since they were consensual. We saw the effect on the other eye, and then when you removed the light. So thank
Perfect.
you. The next one is inside of SimBaby's airway. That's gonna be fun.
Okay, so let's switch
if you
over
could
to
take us
my,
on a tour.
we're gonna go on a little tour here. Yeah. All right. So here I am here. We got SimBaby. I'm gonna bring, hey baby, we're gonna just bring you up the table as well. I'm gonna, just like real babies, I'm gonna put a little bit of padding underneath the shoulder just so that I can get that nice sniffing position that I'm looking for. And we can actually go down. So there's those pupils again. There they are. Hello. And then I can go down inside that airway and take a look inside. So there's the epiglottis right there. So I'm going to try to, I got a Miller blade, so I'm going to try to get up underneath and grab that epiglottis so that we can see that airway. So there's that airway right there. There's the vocal cords. Oh, spinning the wrong way here. I'm doing this with my right hand, so it's a little bit more fun today. So here we have a full pogo score here. We can see everything. Everything looks good. Versus we can partially occlude that airway. You can see it can kind of close up to give you less of a view. And then we can actually laryngospasm and just really close up that view so that we can't see, we can't pass the tube there. It also creates apnea. So you can start to hear those alarms going off in the background. And then when we're ready, we can open up that airway all over again. So that's inside the airway. When we move out, we can actually see the tongue. Let me see if I can hold my hand here. So we can also, there's that tongue. We can also swell that tongue up a little bit. So that's a medium swell versus a full swell. And so that's going to decrease my ability to get in and get a great view as well. But there's that epiglottis again, where we can hook back in and see that vocal cords there again. I'm going to relax the tongue here again and then just show you that airway closing up. So you can imagine this would be a nightmare for someone going in and trying to get an airway. Now, if we move back out, I can show you that trach. So the trach has a little plug here, so we can just take out the plug, and there's my trach, and then I can take my trach and I can do a partial close, or I can completely close it. So you can see your trach access, and there's open again.
And
medium.
Shane, are those the same buttons that you're using for the trach and for like someone who doesn't have the trach and adds it, there's not any updates to LEAP they have to do, they got everything there? You just have some people wondering.
Yeah, so I can take you back out to the LEAP software here.
Yeah, I think that would be.
Yeah, so let's take you back to the LEAP software and share. So this is back out to the LEAP. Let me know if you're able to see that.
Yep.
Okay, so here I'm actually adjusting. So there's the tongue. So anytime you're in LEAP, if you hover over one of these, you can actually see what it does. I do this a lot of the time for my rights and my lefts because of the fact that sometimes they're backwards when we're looking. Let's see. Oh, sorry, I don't have it on the right camera. Just I'm just going to change my camera.
We're seeing LEAP, if that's
okay, there we go.
Us to see. Yeah.
Perfect. And so sorry, there we go. So now when we're into the LEAP software, you can, if I click on the tongue once, we get a medium and then we can max it out versus if I click on it here, there's my laryngospasm. So that's partial and there's complete. So you can see that the complete actually closes off. You can also see there's a foreign body airway obstruction button right here, which I really love because you can actually put that on and you also have tongue fallback, which is you click on that and the airway doesn't open until you tilt the head and get that baby in the proper position. And so you can also see there's airway and compression and resistance here. So SimBaby's airway is quite, you can have quite a fantastic opportunity to capture and as well ventilate, but you can also have a very troubled intubation and chance for capture with the SimBaby. Yeah, you can see here, this is where your pharyngeal edema button would normally would just be up here, but instead you can see with the trach, it comes up as this right here. And just below that is your pneumothorax. So you can actually create a left-sided pneumothorax and actually do a needle decompression in the thorax to relieve that pressure. And I actually printed off a list that comes on the website there. So when we're looking at doing a needle decompression, we're looking at an 18 to 22 gauge needle. And then when you're doing any kind of like airway maneuvers, like what we were just doing there, a laryngoscope, you're going to be using a size 0 or a 1 Miller blade.
Awesome.
So that's some more information about that.
Yeah. Shane, we had a question again from Donna asking, does SimBaby work with the ASL 5000?
Whoa, Donna should get a prize for that. Like, you couldn't set us up any better than that. That's a great question. So SimBaby does accept the ASL 5000. Yeah, look out for that. It's a great addition to the ASL family, and the ability to to provide mechanical ventilation to this baby as you would a real patient.
Yeah, awesome. And thanks, Dave Shablack. We're actually going to be mentioning you a little bit later. You'll see why. But he put in the chat, someone was asking about some of the tear points that were sensitive when SimBaby was first launched. And yes, there were reinforcements added in those points in the skin. So that's a really, really great point. I appreciate you jumping in and mentioning that. So thank you.
No, thank you so much, Shabby, for mentioning that, because if you have a SimBaby and it was bought before the improvements were made, someone from Laerdal should have reached out to you and say, hey, we'd like to bring your baby in for the improvement. And that included creating more stability around the incision sites, the ostomies, the holes, the corner of the eyes, where the baby just was a little bit weaker. And so they offered a free improvement, and you just had to send the baby in. They did the improvement and sent it back out. So if you have one of those babies, reach out to our tech support teams, and they can get you in touch with someone that can arrange that improvement update for you. And if you already have it done, you already know the benefits of it. So
yeah, awesome.
That skin tearing thing is no longer an issue.
Yes,
or
it definitely shouldn't be.
You definitely have to put it through its ropes a lot more, to get the tears that are not fun to get.
Right.
Good question. Good.
Yeah.
Thanks for bringing that up.
And so Shane, the next thing that we got requested was, we kind of talked a little bit about it when you talked through the eye functions, but can we maybe see the seizures, what those look like on the full body, the eyes?
Yeah, so let me just switch my camera again here. Let's see if I can get
let's all just give a shout out to Shane with all these cameras. We love it. And if you guys also, if there's anything you want to see up close, you can let us know. But Shane's really
just because this is our agenda. Again, remember, back to you, this is your show. So if there's something that you need to see to say, yeah, this SimBaby will work for us, let us know. That good point about the central cyanosis versus peripheral cyanosis, those are great features to have, but these are the ones that the American Pediatric Association said that the SimBaby needs to have this. So I'm actually going to take that one and move that forward and say, hey, we got some clients looking for this, or is this ever going to be possible? So keep that feedback coming in. All right, great. Awesome. So here's so you can see my SimBaby's trying to make a trip off the table here. Get back here, Leo. Come back here. All right. So I'm going to take that pad out now, because I'm going to start to get him to move around. On my leap here now, there is a screen, and I can show this after. But right now he's just in motion, but I can put him in full seizure, and you can see his arms will raise and he'll start to shake. Now, that is just the muscle tone seizure that's coming from there. We can also have his head seizure. So when I bring him back over to this, let's see if we can, there you go. So you can see his arms will come back up, but now we can also create a head seizure. And you can see that a little bit better right there. His head will seizure, and including with the head seizures, now we can get the eyes to seize. So let me just hold him up a little bit so you can see his eyes seizing. So that is head seizure, eye seizure, and a full seizure. So if that, I mean, I worked in the front lines for 20 years, and when I see SimBaby reacting this way, it definitely gets my head going back to my algorithms to stop this action, to start to provide therapies and get some help. So I find that that is very effective. The other one that I really like that he does is he does a limp head. So I'm actually going to hold him sideways and switch my camera.
Yeah, so we're gonna look at, I guess, some of the tone settings, and Fontanelle was also another one, so this might be a good view for that too.
Absolutely. Yeah. So let's say I'm gonna put his body limp. So right now his body is gonna be nice and limp, but his head will still have a little bit of tonus there. But I also have the ability to go limp head, which would then create this very, very flaccid baby needing resuscitation, needing help of some sort. So the limp head is another one. If we flip back over to that other camera again, sorry about the flipping so much, but I just really want you to be able to see. All right, so there we have the fontanelle, and now this is a normal fontanelle versus we can have the fontanelle's bulge. And I don't know if you can see that, but it actually creates quite a bit of difference. Let me see if I can get a different angle for you.
Yeah, we see it there, but if you wanted to go back to
so I'm going to go back to normal. So this would be normal, no bulge, and then we have a fontanelle bulge. So you can see it actually comes out. And you can feel it. It's very, very tactile, and it definitely will initiate a response or give you more of an idea of what diagnosis to use. The other really neat one to see is in our PALS courses, we have a scenario where the baby has an enlarged liver. So the liver edge, so we can actually create an enlarged liver, which will then inflate a bladder underneath, just underneath the rib cage here, that when you palpate, you actually get a liver edge. So you can actually feel that enlarged liver right here on SimBaby. So that's another really nice and great feature that has been added into SimBaby.
Are you able to, does it show more if there's a shadow or a light shade?
Oh, you know what?
Like
that's
with
a
the
great
seesaw
point.
Feature? That's always
so let's see if I can create a shadow, because where we're operating virtually here right now, it's sometimes hard to see. So let me just see if I can, should be right there. Let me try one more thing. Let's create a little bit of a different mood lighting here. And I'm going to hold that right there. And I'm going to click this button.
Yeah, we see that. You can
see it right there coming up. That's gone there now. There it is right there. You can see it.
Awesome.
And again, it's very, very tactile. It's very easy to palpate it. And when you feel it, you know it. So it's a great learning tool that way. But yes, breathing. So let me just increase his respiration rate here so that we can get a good idea of what his different breathing patterns are. So I'm going to have him breathing about 36 times a minute here now. So he's just getting a little excited. I'm going to make his chest rise. I'm going to go deep. So he does have the ability to do a shallow, normal, deep, or irregular, which is a really good one. So there's a deep respiration here, and I can actually change the pattern from normal to retraction to seesaw. Now SimBaby Classic did this, but I can tell you right now, there's the retraction. You can see that even without the light. So you can see the big in draw coming right there.
Yeah, that's awesome.
And then when we change that, we can change this over to seesaw respiration. And you can see, there it goes.
Yeah.
Now we're getting much more belly, abdominal muscle involvement. We're seeing the stress of the breathing. And now you throw in a little bit of, chest auscultation sounds, anterior and posterior. You're getting into a really great, and I mean great in regards to our learning objectives.
Yeah.
Breathing
Shane,
scenario.
if you don't mind me interrupting, Tricia is asking if we could see the options for seesaw, retraction, all that on the Leap platform where we access
totally.
those?
No, yeah, totally. Let's do that. And I'll leave the camera on the baby. So here now you're able to see the Leap platform. So your seesaw, so I got them on seesaw, so I can change them to normal. This is where I change my shallow, normal, deep, or irregular. And then I can change my pattern from retraction or seesaw. And these, and you know what, SimBaby Classic did both of these as well, but they're very marked on the SimBaby tetherless now. We also have a preset up here. So there's your left-sided tension pneumothorax. So I can click that, or I can go over here and click this as well. So that's the way that we do that. He also has stomach distension. So people that like to hyperinflate this baby, the air will go down and create gastric distension, and we can see that we can release the air from here if that's not maybe the learning objective that we want, or we see that they do something to fix this problem, we can then release the air. But that's how we control that inside a Leap.
Awesome. And while we're on Leap, we had some questions about some of the heart sounds and just overall vocal sounds. What does the library look like there?
Okay, let me just let me change my view here. I'm going to reset to my default layout because I want it to look just like the ones that you guys have. So when it comes to chest sounds, you can see that we have the preset up here. So we can go left lung, we can put striders in the left lung, which would then give the right lung, or we can break the difference between the two and we can change it to something else. Let me just make that nice and big. So then we have that, or we can go to Mara body sounds, and here we can actually change speaker by speaker. So anterior versus posterior or lobular, we can change the speakers. So there's your rhonchi, stridor, fine crackles, coarse crackles. The only one that I find is really missing is the croup. I really like to build croup into my scenarios, but I can tell you right now, a lot of the times what I do is I just download the croup sound, I make it into a raw format for SimPad, or I put it into a WAV format for my Leap computers, and then I'm able to just add it that way. So if that's something that you're looking for, reach out to me, reach out to our team, and we'd be more than happy to show you how to build that and put it in. The other thing I really like about this window is that I can actually change the sounds. So I can actually make something louder on one side or quieter on the other. I really like that. So there's your heart sounds up here as well. So you can see your heart sounds are quite elaborate, like there's quite a lot here. This would be really good for your your cardiology teams, more so than maybe, like I know my profession, it'd be also really good to know what normal sounds are and what adventitious sounds are, but just knowing the difference between normal and adventitious is sometimes usually the best course of action for some of my teams versus some of your teams might need to diagnose what a diastolic murmur sounds like versus I don't know, a gallop or a pulmonary stenosis. So,
awesome.
Yeah.
Shane, do you think, I don't know if it's loud enough, but Pamela was curious to hear some of the vocal sounds. Like I see we have, the grunt,
wait, now we can,
like
yeah. So here, wait now, Leo can be on the show too. That's a fun one. We'll do that one for sure. So let's put Leo on the show. Let's here, Leo. Oh, not that one. Let's go to the other camera here so you can actually. All right, there he is. I'm going to give him the headset now.
Let's see what he's got to say. All right.
This is my favorite. This is the way that I want my baby to be.
Content baby.
Then we can cry. Then we can loop them as well so that we can. All right, Leo. Were you able to hear that?
Yeah, it was a little bit faint just because the mic was distanced from his speaker, but that's okay. We heard them, so
Perfect.
I think that drove the point
Yeah.
home. He has a good amount of vocals.
He's definitely louder here in the room. I mean, this mic that I'm wearing is very just isolated to just mouth. So the sound is actually coming out of the top of his head, not his mouth, because we had to move that speaker because obviously you're going in there with Miller blades, Mac blades, you know, you're going in to intubate, it would damage stuff like that. So it has to come out of the top. Okay, you Leo, okay, thank you.
You're
All right,
good,
you
Leo.
stop coughing. Don't forget this button right here. This is always a button that a lot of people don't know what it's for. And this is auscultation focus. So what auscultation focus is if you have a student that says, I'm listening to the chest, but all I hear is, or I hear a squeak, 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 or you hear some kind of non-human-like noise. Well, there's little motors in there and there's stuff, and you know, people coming to class with cardiology 3 stethoscopes that can hear the ant on the other side of the table of your patient. Well, that's how powerful these stethoscopes can be. So auscultation focus, what that does is it gives you 30 seconds, and I keep on, I can add more time to that. It gives you that much time where all the motors and motion and all the kinetics of what's making the baby work stops. And the only thing that's playing right now is just the speakers. So you're just getting speaker noise and not getting any of the movement. You can see his arms have stopped moving now. You can see that his compressor, his internal compressor, is actually now stopped because it's concentrating on the speaker noise only. The only thing you have to worry is you have to let your participants know in a pre-brief that you have the ability to do this. So if they just want to say, hey, I'm hearing a whole bunch of different noise, you push the button. If they don't have a stethoscope on the speaker, the actual kinetics of breathing stops. So they actually think he's gone apneic.
Right.
So that's just something that's a little tidbit from us to say, you just need to, you know, let your participants know, your healthcare providers, your students, that you have the ability to do this, but this is what it's going to do. And if they start to go apneic down that, I can always hit the cancel button and he'll start to move and breathe. There he goes. Hello. And he starts to move and breathe again as he should. So that's another button that gets underutilized, but is very impactful when it comes to simulation, especially around students wondering about squeaky and robotic noises versus human breathing noises.
And Shane, that's available like on all our high fidelity simulators, like even the SimMan. So just not only
nursing and
SimBaby.
simulator, nursing and simulator, SimMan 3G. It wasn't there before. It was there a long time ago, but a lot of people weren't using it. And I think there was just a little bit of education that had to be used around the buttonology, the science of the button.
Yeah, totally. That's an awesome one. And it's true, not everybody, you know, might know exactly what it means. It's not totally self-explanatory. So definitely appreciate it. Shane, so the last thing before we move to other topics, again, if there's questions, we'll keep with the baby. But one of the things we got requested was just a little bit about the ECG functionality, electrical therapy, and such.
All right, let me just see here. Okay, so with the electrical therapy, the SimBaby actually has posts on his skin for the 3-lead ECG. So I'm just going to hook those up. I got my trusty LifePak 12 over here, but this can be used with you know, Zoll, Drager, Philips, all of them. The only thing different is with the defibrillation side, we'll just need an adapter. to know which one you want to go with. I'm still trying to figure out my rights and my lefts still. So there we go. So now he's hooked up. I can actually turn on my life pack. The rhythm is going to come up here. So that is all hooked up and good that way. Now, when it comes to the defibrillation, and don't forget, we also got our virtual monitor as well that has also a defibrillator built into it as well. So if you haven't used the defibrillator function on this, just remember that if you don't have a ShockLink system, you could still do a virtual defibrillation using your touch screen with the Laerdal monitor. So there's my monitor defibrillator. If you're not seeing the monitor defibrillator on your patient monitor, it's more than likely we haven't updated in a while. So go back and look at our episode about how to update your mannequins and how to update your software. Just remember that we're going to be, you're going to be looking at Windows 10, a lot of the computers now. Windows 8 is no longer supported with the new Leap. So just there's some things that you might want to consider before you upgrade. And again, our tech services, your CE representative, come talk to us. This is what we love to do.
Shane,
so that.
before you continue, sorry, we're still seeing Leap as the main screen. We see you in small, but we have some people wanting to see a little bit more of you in the monitor. Yeah, there you go.
Yeah, there we go. Thank you so much. Yeah, anytime that happens, just let us know. So yeah, I got them all hooked up here now. There's my monitor, and there's my defibrillator. But I also got them hooked up to an actual real live clinical life pack 12. So in order to defibrillate, we're going to use ShockLink. So you're going to have a ShockLink system. And again, the ShockLink system is going to need an adapter depending on if you're going to Physio, Zoll, or if you're Philips. Now, if you're Philips, then you don't need an adapter. It comes standard Philips. But in this training episode, I don't have pediatric pads, but what I do remember is that whenever we don't have pediatric pads, we can use some adult ones. And I can actually just place them right onto the baby's skin. So underneath the skin is actually one of these, but it's upside down. And so these actually connect through the skin to that pad that's underneath. And this is why it's going to be great, is because now we can do pacing, we can do defibrillation, we can do synchronized cardioversion, and all that stuff. So let me just put this one on his back. There you go, baby. All right. Now, if I go over to my clinical life pack 12 here, and I change my leads over to pads, now I'm able to interpret the rhythm coming from the pads. I'm going to go over to my Leap software now. I'm going to change his rhythm. I'm just going to put him in VFib, and now there we go. All right, he's gone into VFib. There we go. There we go. And I can take my monitor now and select my energy.
Shane, not sure if you're wanting us to follow on the screen, but we're listening.
Okay.
We're watching the baby.
Watching the baby. Yeah. Let me, I can change back over to the other camera here. All right, there's my camera screen. Sorry, guys. Sorry, everybody. Let's change over to this one. So I have my pads attached. I have a rhythm now. I've put the rhythm from one shock back into a normal sinus. So let me just bring him back. Switch. Let's change my rhythm again to a VF. So there he is back in VF. Alrighty. And now that he's in VF, I can take my defibrillator, I can charge, I can see the VF coming up here on my defibrillator as well. I'm clear, you're clear, we're all clear. And the shock is actually being delivered, but it actually stops at this attenuator right here. So there's actually no electrical charge going out to the baby. All the information is coming from the baby into the system. So so that way that energy is safe and it's no longer around the baby.
Perfect. And Shane, as just a last question, can you tell us a little bit about what that hole is on the bottom of Leo's foot?
Yeah, so Leo also has the ability for bilateral IO insertion. So these are actually where I would hook up my drain bags or infuse some blood into here so that they can get flash on their IO. So it's bilateral tibial tuberosity placement there. Now I'm going to take off. This is the number one thing I can give a tip about in regards to the shock link and the training pads is that once you're done using them, after the scenario is over, make sure you take your pads off, put them back on your sticky so that you can get many, many uses out of them. The longer that they stay on the skin, I did something funny here. I wrapped it around my 3-lead ECG. Folks, we're live, so everything that I do is fun.
All good.
There we go. And now we're back. Okay.
Perfect. So I'm just trying to see if there's any other questions about the baby before. And yeah, if you guys have moulage questions, our friend David Shablak is in the chat there, who is a moulage expert and uses a lot of our products. So he's very familiar with the, I guess, challenges or lack thereof challenges potentially using a silicone-based skin versus what we usually have on other mannequins like PVC with the SimBaby. So definitely, he says, hashtag not an expert. I mean, better than me, so.
Specialist.
Yes, specialist.
So yeah, there is some questions about moulage on silicone, and we did an episode with Shabby back in a few 2 Halloweens ago, where he talks about what sticks to silicone. And so, I mean, if I can steal that again, it's silicone sticks to silicone. So you can make reusable, he has really great techniques on how to make reusable moulage for your simulators, so that you're not putting in all this work and then all of a sudden in 10 minutes it's gone and then you got to do all the work again. So tattoos is a good option. But staining, like I said, back to the pen and the permanent marker, there's not much that's going to stain these silicone skins. Follow the cleaning. The big thing that I can usually give a tip about the silicone skins is that sometimes lint will stick to it. The best thing to take that off with is like a 4x4 gauze, spray it with silicone lubricant. So that's the lubricant that comes with most of our simulators. I'm just seeing if I got one lying around here, but you take the lubricant and you spray it on the 4x4 gauze and then you rub it over the skin and the lint just comes right off of it. Awesome. So that's something beneficial to the silicone skin. The silicone skins are definitely more durable. Nothing sticks to it. So that's the trick, right? If you're putting on an op site, you're going to have to create a silicone base, which the silicone dressings come with SimBaby, and then you can get them at your medical, provider store, vendor store, and then your op site then goes on top of that base. So then it really adheres to it, but not adheres to your simulator, which will save you time with cleaning. It will save you time with the skins looking great, fresh and brand new.
Awesome. Well, Shane, thank you so much for this demo. I think at least I always learn a thing or two, but I hope everybody really enjoyed it. I know we have about 30 minutes left, and if some of you have to hop off, remember this is recorded. So the only thing that you might not be eligible for is the giveaway. So I'm just saying, throwing that out there, but we're gonna continue on with our one of our hot topics, which is the Laerdal sun. So let me know, are you seeing my screen? Is everything?
Yeah, sure I am.
Perfect.
I'm so excited. We get to be together again with all you cool folks, and really talk about how we can do this better, how you're making out with it, and give you more information and get really networking together. Like this is a cool time to be after COVID. This is
yeah, I'm excited. I hope we get to go. Maybe if you guys protest for us to be there, we'll be there. But we have some
We'll
really,
sign
really
your
great
non-silicone skin.
Yes, babies. Yeah.
Simulator.
So this sun is, so for those of you that aren't familiar with the sun, it's a simulation user network conference. There's opportunities to network with your peers and experts, learn from industry leaders, get tips and tricks on best practices, get some hands-on training, some education. It's a really, really fun experience. So if you haven't yet heard about it or seen about it, you can scan that QR code not only to save your seat, but also to learn more about the sun. This year it's going to be in Houston, Texas from September 12th to the 14th. So we're really excited for it, as you can probably tell. But yeah, if you have any questions on it, let us know, and we'll do our best to answer. And then Shane, can you walk us through some of these classic updates we usually go through?
Yeah, so I always like to keep you guys updated with in regards to the numbers and where we are with the versions. So if you haven't heard it before, this is probably the third time we said it. SimPad Classic is discontinued. So the highest you can go with that is 7.4.5. And when you're talking about Leap, like the patient monitor that you want to connect with this version, it's going to be 7.3. The new SimPad Plus has a new version. It's 8.1.1.9. So remember to read the release notes before you download it to see if it fixes the problem that you're having. It's always best before you call tech support to update to the latest version, mostly because the newest version might have fixed the reason why you're calling. Hopefully we get there. Theme editor, if you use theme editor in the past, Flash went away, Flash player. So we had to change theme editor a little bit. So now that's a downloadable, installable program, and it's on version 1.3. It's still there. Leap is at 8.2. Now you'll notice that SimPad and Leap is different, but that's okay. That's because the Leap had to adjust for some other reason or some other product, or there was some bug fixes. So these numbers won't always coincide, as you can see from the SimPad Classic version up above, but Leap is now on 8.2.0. And I never want to forget that there's resources out there for you in regards to how-to videos. Yeah. And so there's the QR code to get to the how-to videos, to find your simulator and find great videos on how to do some of the things that, you know, if you don't do them yearly, they get a little rusty in the back of the head. So awesome. I use those videos all the time.
Thanks, Shane. And drum roll, because we've made it to the
giveaway.
So we first off wanted to thank you all so much for those who participated in our little question during the registration process of what topics would you be most interested in learning more about. And we had some really interesting themes and kind of similar answers. So we kind of took the ones that stood out to us the most. So if you have something, like I saw in the chat, someone wants to see SimNewbie, we could totally add that. So it's not exclusive to these answers, but we figured some of the questions actually, or some of the ideas or requests are things that we've actually covered and you might not know about. So we thought we would put those episodes here. If you don't have access to your phone right now, or you're watching the recording, you can actually find these on our HSL landing page, on our YouTube channel, or you can just email us and say, I want to see the Moulage episode, and we'll send it to you. But yeah, we've actually done a few. The Moulage episode, as we just mentioned, was with our friend and colleague and host of the Sim Geeks podcast, Dave Shablak. So he was on showing us how to properly do Moulage and what works with what and how to make things just look as realistic as possible. So definitely.
And I think he also posted another YouTube video on there too, Alyssa, about what sticks to silicone. And I think that was through This Old Mannequin, which is another podcast that he does. So yeah, so
thank you, Shabby.
Yeah, awesome.
And we also had requests on scenario design, which we've done, connectivity, how to do updates, how the networks all connect with our simulators. SimMom was one of our most recent episodes we did. I think the last episode was on SimMom. We talked about PPH, other functionality, some other obstetrical solutions. So definitely there is a repertoire of episodes, and these aren't the only episodes we've done. So again, you can go to our website or to our YouTube channel, and they're all housed there. So Shane, why
And
don't
we
we
had
go
some
through?
great guests, and like
We had
we had
Ingrid
John
Laerdal,
Laerdal,
we had
Ingrid
John
Laerdal.
Laerdal, we had
Yeah, so
Dave Shablack, we had Mike
yeah.
Helbach on a
Mike
resuscitation
Helba.
focus.
Yeah,
So we've got
huge.
some good ones.
Yeah.
Let's go through some of the newer, I guess, ideas on things we haven't done. So Shane, did you want to talk us through this?
Yeah, so so we did one on a nursing and simulator,
Right.
but it was very early in COVID, and it was very early during our development of the
Yeah.
HSL webcast. So we'd like to spice that one up a little bit, especially now that she has newer skins. She has geriatric skin, she has African descent skin, she has the new male genitalia, and then she also has geriatric male genitalia. And I think in a couple months, or probably in Q3 or Q4, they're actually coming out with a male skin for the chest and for the face, because it's all attached. SimMan 3G, like, oh, did we ever forget about SimMan 3G? OG. Let's go back
3G.
to OG, because I want you to take SimMan 3G, because most of the time when I talk to my clients, they're like, we don't use all of his features. We underutilize him. So I think we should do an episode on SimMan 3G OG utilization. So let's pull out some of those features from the closet and get them being used, like bleeding, the RFID, the seizures, the whole fluids in regards to sweating and tears and crying, and adjusting the little screws in behind the neck. So I'm really excited about an episode about that. So and then it'd be really cool to have a 3G plus. This would probably take 2 episodes, but where, one, what can I do with 3G that I can't do with plus, and vice versa.
Right.
So that'd be really neat. Utilizing Sim Junior, I'm going to have the opportunity in June to go down to New York and really utilize Sim Junior with our field service engineers and get him doing things that he's not really designed to do, but we're going to find some simple techniques that we can use to get him bleeding. We're going to get him to do maybe some anaphylaxis, and really using Sim Junior even more so than what he was actually designed to do. And we got Sim Capture. So down in the link, we're looking at maybe doing an episode down there where we can really bring Sim Capture into light in regards to how it's a program and not just video capturing techniques.
Right.
It's actually a debriefing educational program. It's amazing. We'd really love to showcase that one a little bit more and get you guys, get everyone using SimCapture to full potential, and really talking about the difference between a pro versus an enterprise or solution. So tips for simulation and debriefing, I'm going to throw in a little hook here now. Laerdal has a core debriefing course out there that's still going through its phases, but you're going to see that coming down the pipeline. And for our US clients, that's already on the go, I do believe. Up here in Canada, we're still doing the auditing to make sure that we get it just right before it's delivered out to our clients. So hang on for that. But we can do another episode on tips of simulation and debriefing, and maybe we can bring in some fantastic guest speakers. So if you or someone that just excels in this, drop us a line, and we'd be happy to share that expertise if they're willing to share it. And then we have VSIM. So we have a great VSIM team, and we can definitely bring them on the show and really highlight VSIM or some of the areas around VSIM that you would find very, very useful, especially with implementation of VSIM in a new school or a new nursing program.
Awesome.
Very cool.
Great. Well, I think that does, I mean, there's definitely other topics. Again, we kind of just took some of the ones that were very much repeated throughout a lot of your comments. But I know there's some people that are interested maybe in seeing the ASL 5000 from the chat. We can see sim capture, so that's good. We've captured that, no pun intended. I'm a VSIM lover. Yes, we love it. VSIM is awesome.
Cool.
So
awesome.
Great. And I mean, without further ado, we're kind of doing a little bit of a different giveaway this time.
Yay!
As we're building our HSL simulation community, we thought it would be a really nice way to give back to you guys with a nice little coffee mug that you can bring on the go, and a set of pens for either your courses or just to use an everyday. We have 2 color options, so we figured this would be kind of a nice different giveaway. Hopefully no one's like too disappointed about this. We were really excited about it. But again, Shane, do you want to tell everybody how these giveaways usually work as I go over to the wheel of fortune?
Yeah, so the way that the giveaway works is that in the registration we asked a question, and we're taking this one as everybody that submitted an idea, or I think even just said you guys rock or something like that, we put you in. So with those ideas, then your name became on this wheel, and Alyssa's going to spin the wheel, and then you're going to have 10 seconds to comment, because this is only for live registrants. So you have to comment that you're here, and then after 10 seconds we'll spin the wheel again if you're not. So
Yeah.
let's see who's here. Let's
All right,
spin the wheel.
let's go. Do you see the wheel, by the way? Yeah.
Oh yeah,
Okay.
it's spinning.
All right, so
Fantastic.
Oh, Jason. Do we have a Jason?
Jason Barnett, are you here?
Everyone's like, I'm here. Oh my gosh. Hold on. Do we specifically?
So let me
Jason is here. Jason is here.
Yay, Jason.
Awesome, Jason. Okay, so anyone, by the way, that wins. We have 2 winners. We'll be reaching out to you, so don't worry, and we'll get your shipping addresses and all that cleared up. So we have 1 winner, Jason. Congrats. Everyone else, I'm sorry you're saying.
Jason, where are you from? Can you just give us an idea of the state, province, island,
organization,
temperature outside? We can spin the wheel while we're waiting for Jason to come in here.
Texas.
Longview, Texas. Yo,
EMS.
cool.
Awesome.
All right, from my profession, my neck of the woods, right on. So I used to hang out in Katy, Texas for a lot. So hey, cool, awesome.
All right,
we got some gear going down here. Let's spin it again.
Spin it again. Oh, I hope it doesn't land again on Jason, because I realized I didn't take his name out. But Angela, do we have an Angela McJunkins? That's an awesome last name. Do we have
Angela? Angela, are you here?
And again, we took this list at the beginning, and I know a lot of people had to jump off. So if we don't get an answer in a few seconds, I will remove the name and go again. All right. I don't think we have.
No, let's go again.
All right. This narrows the pool down.
I think there's too many names, and the sound can't keep up with how many names is on there. That's so cool.
Lori.
Lori, are you hanging out with us? Grupo.
Lori. I don't think we do.
I don't see anything yet.
All right. If you're there, Lori, you got a few more seconds.
Well, you're gonna spin it, but as soon as that new name comes up, we have to move on. Lori here, because we know someone that might be here.
Carmen.
Carmen, are you here, Carmen?
I'm trying to see if any of the names here.
Carmen. Wow.
Wow. That's okay. I mean, we had a lot of entries. We can also do.
Yeah, we're over time now, aren't we, too?
No, we have a.
Oh yeah.
Yeah.
No, we got.
It's just at the hour we do have people that have to drop off.
Yeah, totally. Okay, let's spin it again.
Yeah, let's spin it one more time. And what I can do is I could take the names that are here and run a complete separate wheel for those of you that are with us today. So we have Catherine. If we don't have Catherine Moreros, we'll do a custom wheel for you guys.
Yeah, actually, if Catherine is not here, while you're doing the custom wheel, I'll start logging into some of these questions that some people have asked here.
Yeah. Totally.
I was going to hold them for Client's Corner. So, all right. So as
go ahead, I'll make the custom wheel.
As Alyssa creates that wheel. Janice Ryder,
put your names in.
Here. She's going to grab a list of everybody that's online here now, and then we're going to spin it again. So some of the questions that I've seen there, if you have an older SimMan 3G, so he's an XP, and so they can be anywhere I've seen some 2015, 2014, and then everything before 2014 is definitely XP. So those boards can only be updated to 7.3. So that's the highest that they can go. If you go higher, there will be a warning that says that it won't work and it will become a paperweight and all that stuff. Now, back in the day, and I'm only talking about maybe 6-7 months ago, you were able to pay a fee to get the upgraded board from the XP to the new Windows 7 board. And as of a couple months ago, we've actually discontinued that because we're in the beta testing of the Windows 10. So currently right now, you can't pay the $7 to, in Canadian dollars, it'd be closer to $10,000 to upgrade those boards. We're putting a stop on that as the Windows 10 is now being developed. No, it's farther than development. It's in the beta testing in our shops to make sure that it's the stability and the connectivity is exactly what we know what it should be. So I've heard, now this is a whisper because I'm not supposed to talk about this. I heard that it is more stable. The connectivity, because now we're gone to a dongle, is much better. The Windows 10 board is solid, but I think they just need a little bit more time, a little bit more tweaking to get it great for you and your teams. So that's the answer before that. Windows 11, I haven't heard of anything. I would have to talk to my tech support team in regards to the Windows 11. But right now, like I said, we're working on Windows 10, especially when it comes to Windows inside of the high fidelity mannequin, the SimMan family, SimMan Essential, SimMan 3G. So remember, inside SimMan ALS is a link box. So that's where they kind of get a little bit different.
Do we want to spin the wheel?
Yes.
Okay,
yes, we
sorry.
do want to spin the wheel.
I don't want to interrupt you, but I want as many names as I could, you guys.
Did you put my name on? Because I want one of these mugs.
Oh no, you don't get one. All right.
Okay, this is who's left. All right.
Okay, let's go. And I hope you're still here, hopefully. But I took the names that were in the chat from. Oh my God, no, not Shabby. Shabby, are you still here?
Uh-oh. Oh, there's people saying they're not on the list.
Oh, I'm sorry. I actually tried to take the people who wrote they were here. I'm so sorry. I thought because maybe
do you got one of the whole list, Alyssa, of who's left?
I can't actually pull that. We have a lot of Laerdal people on here too, so unfortunately we would probably
so there's a lot of people. There's a lot of people saying
okay, Dave is being nice and he's spinning again.
No, but we need to build a list with everybody, and if it's a Laerdal employee, we'll just have to spin it again.
Okay, I don't know how to do that. I'm sorry. I was doing it manually, guys. Oh well, Janice, are you still here?
Yeah, no, that's okay. You know what? We can.
All right, Janice.
I agree. You know what, Donna? Donna's calling us out. She says that's not fair. Answer more questions. Yeah, the spinning of the list thing, we tried to really get that working, and you know what, it's that.
Yeah, we've never done it on the spot before. I'm sorry, and I was just trying to see who put here, which I probably should have tried to get a full list, but I can't.
Yeah, we see that your names are not on the list. How
about
really
we do like a little quiz on what we saw today on SimBaby?
Okay, I think that's fair. Yeah. Here we go. Let's make up a question, and then the first one that posts the right answer wins. I think that's fair for the live audience. Now,
you've come up with a question because I feel like you got it.
Yeah, I'm pondering. We've covered a lot of information today. So SimBaby. We did SimBaby. Oh, what program allows a 3-year subscription for a simulator?
Oh, we thought we were going SimBaby.
Flex.
Oh, who's the first? Trisha.
Trisha, there we go. Yes, all right. So
Trisha, and
thank you, Donna, for calling us out and saying it's not fair. Correct. Everybody for saying that their name was not there. You know what this is telling me? We need to get more merch. and we're going to
Yeah.
give out more prizes. And you know what? We're going to make sure that we stay connected. And if it means that you get to put coffee into one of our mugs, and then we get a chance to think about simulation and how we can impact our communities, our world, and create better lives and help save some lives. I'm all about mugs and pens then, if that's super
Yeah.
cool. Thank you.
I mean,
Thank
we
you
didn't
so
expect
much
you
for
guys to be
being
so
here.
excited. This is awesome. All right,
All
so
right.
our two winners are, let me go back to the top, Trisha and obviously Jason from the wheel. Luckily we had, and I'm so
And we'll also
sorry.
have
I
more
totally
opportunity.
misunderstood that.
Yeah, and we'll totally have more opportunity in the future, because in the past we've given away ShockLink systems, we've given away little ANQ
Littles.
CPRs. So it's not all about mugs and pens. It's just in the future, as we see the products coming and going, we'll be able to give more giveaways. Our Christmas time is always a great giveaway time. So
Yeah.
thank you so much for joining in. We do have time for a little bit of Client's Corner.
Yes.
I think we got 5 minutes here.
Yeah, and if you have to hop, this is a fine time to do so. If you have questions that you didn't get answered, please stay on, and we're gonna get to our infamous Client's Corner. But yeah,
I think a lot of the questions have been answered
winners.
throughout the. So if you asked before and you didn't get an answer, this is a great time. Remember that if you ever need to reach out to us, there's the hsl@laerdal.com. We do encourage that you reach out to your local Laerdal representative if it has anything to do with price, as we can't quote, we can't do anything like that for you unless you're in my territory. If you're in my territory, give me a call.
Where's your territory, Shane?
I'm in CA 40, so Atlantic Canada. So I cover provinces like Newfoundland and Labrador, Nova Scotia, New Brunswick, and Prince Edward Island. And I actually just came home yesterday from a wonderful nursing and simulator geriatric install in Prince Edward Island. What a beautiful province. When I'm not home, it's a great place to be. Got to travel through New Brunswick and then back in Nova Scotia for a quick flight back over here to the island in Newfoundland. So anytime you're in Atlantic Canada, it's a beautiful part of the world. Drop me a line and I'll definitely, if not, have a coffee. We will give you some great places to go.
Perfect.
Any more questions? 5 new messages.
And sorry, my share screen just quit on me, so I'm sorry if you weren't seeing that anymore. But yes, our info is here if you need to contact us with any questions. I feel like we covered a lot of the questions in the time of the episode.
There's a good question right here. Sandy Peterson asked a great question. If you do the Flex program, are the mannequins brand new?
Oh, I did answer that, and I think I answered it accidentally on private. But the mannequins can be a mix of new and refurbished, meaning that depending on the way that they come out of our manufacturing, or if we have a pool of mannequins that are completely refurbished, it might be a mix. So it is possible you get a brand new one. Again, if let's say a product launches, you're probably going to get a brand new one. But let's say we potentially have a pool of SimBaby 3Gs that we've just been refurbishing and using as either loaners or exchanges and things like that. It could be. So not to say that the refurbished don't work. They're up to the optimal standards of use and will not cause any problems, but they probably would be a mix in the pool of simulators. So I'll write that here.
That is a great question. Good one. Yeah, so David just posted, I have a loaner now, it looks new. Yeah, when they refurbish these, you know, you're not talking, especially with the Freedom Program, they're not going to be old mannequins for one. Two, even our CPO units, our certified pre-owned units, when they get refurbished, they come to you looking newish. So
yeah, you wouldn't be able to tell, basically.
If you can, you're probably working with us.
Yeah, exactly. You're probably Shane.
Yeah, no, I mean, obviously we can pull up serial numbers and tell everything where it comes from. But again, communicate your needs with whoever the person is that's talking to you about the Freedom Flex and say, listen, you know, is there going to be a used one coming, or is there new, you know, and then really just talk to them and communicate what it is you need. It's the Freedom Flex program for that reason. It's opening up dialogue and really getting you what you need.
Right. Okay, Trisha, suggestion, nasal flaring, it could use the same function the trach has for wide versus narrow.
Yeah, that would be interesting, is putting in like a little bladder that could create nasal flaring. That is a cool suggestion. The only thing is, I mean, obviously for mental health, we can see, you know, maybe that's the airway passages opening up more to allow more air in, showing some sort of, you know, anxiety or depletion of oxygen. So it's really capturing what is the learning objective, and that's where the feature sets all come from. It's not because we do what's cool or what's innovative or what's the newest trend. We look at the more of the outcomes approach, like where are we failing patient care, and what features can we put into our simulator to reverse that. So if nasal flaring can really help, you know, identify maybe quicker oxygen administration or something like that, then yeah, absolutely, those are the suggestions we're looking for. But we'll definitely, yeah, we'll bring it forward and see if that has been talked about. But good one, thank you. Yeah, in respiratory distress, absolutely. Thank you, Trisha. That's just talking about nasal flaring and respiratory distress again. And, you know, and that would be even more prevalent in the pediatric world. So again, we'll bring that suggestion forward, and, you know, maybe the next venture of the American Pediatric Association, when they look at, you know, some revamps for SimBaby, that's something, you know, and there's another member of our family that, you know, will be updated hopefully sooner than later, that maybe, you know, maybe that's something we can look at for that one. That's good, thank you. ShockLink triggers to leap. So ShockLink, David, can you tell me a little bit more about that? I know that when I shock using ShockLink, it does put an event into my session for, oh, so standalone ShockLink. Okay, I got you. Okay, for the nursing and simulator. Yeah. So I would love nothing more to have the nursing and simulator much similar to the SimBaby, where there's just a ShockLink pad upside down. It will help with a couple different things other than pacing. Like, it still won't help with pacing because we can't put on a 3-lead ECG. But again, the nursing and simulator was developed by the National League of Nursing and Laerdal, and so they didn't really find that was part of it. But yeah, they are looking at more skins having more of the ShockLink systems in them for that standalone ShockLink that can work with the rhythm that's coming from your leap. Absolutely. And also the ShockLink pads stick to silicone yet. I'm sticking it to SimBaby. These pads have been used probably about 8 times now. The stickiness is still really good because of the fact that you got to remember there's no electrical discharge coming out of the pads. So that adhesive in the pads is not drying up, it's not burning up. So I find I can use those pads, and they don't have to be as secure as adhesive to the baby because there's no electrical discharge for the connection. So they can be a little bit less sticky and still stick pretty good. Now, if I was saying, you know, with live shock, well, that's something a little bit different because I need that secure connection. And that's where I usually use, even on non-silicone skins, I'll still use a silicone dressing to make sure that I have that really good connection around the skin over that metal plate. Yeah, silicone adhesive. The only problem is then ShockLink as well. It'd be nice if the ShockLink pads came in too. I agree with you that it came with a silicone pad versus non-silicone, because you got to remember that ShockLink can also be used on a teddy bear. It can be used on a tabletop. It can be used on anything at all, especially with the remote. The app. Yeah, let me just rephrase that, because also you got to remember the app also has all the new pediatric rates as well. So stay away from the remote, get the app, and it's free. Awesome.
Well,
All
we're
right.
4 minutes over. So for those of you that are still on, thank you. And Shane, I don't know if you had any last words or any questions that we have left.
Yeah, actually, there's one more here by
Okay.
Robert Jordan. Said the same idea. The tegaderms won't stick. Absolutely. If you have silicone skin, the tegaderms won't stick because that's a different kind of adhesive. You have to create that silicone base where silicone is attaching to silicone, and then the other base is on the other side where that other adhesive will stick to it. So, yeah, those silicone adhesives will always be your friend. All right. Thank you. And oh yeah, so David, again, look in the comments, look in the notes, the smooth on a fix. Or I'm probably not even saying that right, Shabby, but yeah, just go on over to that moulage episode or the what sticks to silicone episode from the this old mannequin. And I think there was some on your Sim Geeks podcast as well. So and that would really help as well for people that are not only Laerdal vendored. So they have some solutions for other skins and other mannequins as well. So yeah. So with that being said, I think we're ready to close this episode of the HSL webcast.
I think so.
Me personally, I just wanted to say thank you again for coming in. Thank you again for sharing, asking questions, being a part of this. We look forward to doing more of these. Remember to join up on Facebook. We're going to put out a special Facebook announcement next week from a very fun location. So bear with us, and we'll see you again soon. Yeah. Thank you so much, Alyssa, for being a friend and
thank you, Shane,
and being an awesome colleague in this adventure.
Awesome. Thank you, everyone. And we'll be in touch with the winners of the giveaway. And sorry for the confusion, but appreciate
we'll get better at this. We'll get better.
Feedback. Yes.
Yeah.
So thank you and have an awesome weekend. We'll chat soon.
Bye for now.